and welcome to the Town of Norfolk Board of Health meeting for December 4th, 2018. It is approximately 7 o'clock, and we have an agenda which includes at 7 a visit from the Visiting Nurses Association.
Yes, this is Alyssa Kaiser.
Lisa, oh, okay. Well, welcome.
Thank you.
And what brings you here? And
I just wanted to introduce myself to everybody and kind of tell you a little bit about what we do.
okay, we need to make sure you have a microphone.
Oh, let me go.
Sorry.
Oh, that's,
I got the instructions on the microphone.
should be
It's
good to
turned
go.
on
The
and
yep,
everything,
it's
and
on.
you just kind of hold it
No,
there.
and it's
for the
just
cable.
like for the cable because I know.
So I just wanted to introduce myself to everybody and tell you a little bit about what my role is in Norfolk. So I met Frances at the flu clinic. We did the flu clinic with a collaboration with Walgreens/Rite Aid. And so that went pretty well, don't you think?
Yes, I think it went great.
Yeah.
We had about
How many?
53, I think it was.
folks that came in.
And I think next year our plan is to do it a little bit more like a disaster drill, trying to have the flow. The flow was good this year, but I think, both of us thought that it could be improved on a little bit. So in my role here, I do the Maven surveillance, and I send the stats every month. I also did the 2018 fiscal stats. I would like to try to get the Board of Health board a little bit more health education. In other towns, I do a lot of health promotion and educational programming. I don't know if Norfolk would be interested in that, but that's something that we can look into down the line. We had, I think it was two cases. Can I talk about the Maven?
Yeah, maybe you might want to explain Maven.
Okay, so Maven, if you don't know, is DPH's reportable diseases site. So anytime a provider has a positive communicable disease or tick-borne disease or foodborne illness, those results are sent to Maven and then, or DPH, and then they're input into Maven, and then they're filtered down to the public health nurses of the specific communities. And so my role is to do the follow-up with the patients. Sometimes it's very quick. Other times it can be a pretty lengthy process. We've recently had some cases that were a little bit lengthier than like a Lyme would be. And I did some outreach with the client trying to get them the services. I often find sometimes when I'm doing the follow-up that if they were discharged from the hospital, there's a miscommunication and there isn't the follow-up that should happen. So trying to get the patients, which is kind of out of my scope, but getting them the things that they need, making sure that they're reading their discharge papers, things like that. And can I speak about the cases the past month, or is that?
Oh, absolutely.
Yeah. Okay. So I think this past month, it wasn't a very busy month, but we did, if I remember. Sorry, we had two Legionella cases here.
There were two.
There were two Legionella cases.
Okay.
Yeah.
I
So.
see one Legionella.
Okay, so it must have been October we had another one. But in any matter, that's a pretty, yeah, it can be pretty scary to get that. So the one that we just had in November, that's when I found out after speaking to person, that the patient wasn't being followed after discharge, even though their paperwork said they should have. So things like that. I'm here to do any kind of home visits. I go to the CCIT meetings every month. And do you know what the CCIT meetings are? So with the police department, and we just talk about different residents in the town that may need additional assistance.
Excuse me.
So, could I ask you a couple of questions about the infectious disease
Sure.
report? So we have not had any Legionella since, at least not documented, since 2016. That's the first one. There was one that was revoked in 2016, so I'm assuming it wasn't confirmed, if that's what revoked means.
So, yeah, you asked that at the flu clinic.
Right.
Suspect, revoked, and
Confirmed.
confirmed. So suspect or revoked, a lot of times revoked, it's very difficult to explain because suspect means that the patient could technically have it, but revoked means that DPH didn't have enough information to confirm or say that it was suspect. So, for instance, I recently had a mumps case. This is not in this community, but a different community. I had a mumps case that was revoked. So the patient went into the doctor. They had a mass on their cheek, and they did the testing, and one of the tests that we look for mumps came up positive, but everything else was negative. So after I talked to the provider and I did talk to the patient, they ended up revoking the case. So even if something is revoked doesn't mean that you don't have to do the investigation.
Or that it wasn't necessarily positive.
Right.
But as far as the Legionella goes, so where did that person contract it? In the community, or was it in the hospital, or do we know?
You know, after I did the interview with the patient, I have no idea. You know, I mean, I asked the patient about, I mean, it was an elderly individual, and I asked the patient about hot tubs, if they had, you know, stayed somewhere besides their home. Nothing. So I don't think we'll ever know. In some cases, we can never track it down. In some cases, we can.
Okay.
Just as foodborne illnesses, sometimes you can track it, and sometimes you can't.
Okay. Just a couple of other comments about the infectious disease report. So the hepatitis C and TB levels went up from 2016 into 2017, but I think we determined that you also get the reports from Norfolk Correctional Institute.
DOC?
Yeah.
So,
Yeah.
I mean, but we don't know. Do you know?
Yeah,
After you've
so-
reviewed the cases.
We have, yeah, we also
Okay.
get reporting from.
Okay,
from
it was
those, yeah.
not community related?
Yeah.
Okay. Okay.
If we had a community-based TB, I would definitely let you know.
Okay.
Yep. I would have to go out and do most likely a home visit, so.
And the last thing, my question anyway, about health promotion. At the senior center, do they do blood pressure clinics, and is that what you do, or do they bring in other folks to do that?
I do a monthly blood pressure clinic. I think I want to say it's the third
I think
Wednesday.
it's the third Wednesday
Yeah.
of the month.
Sorry, because I have it in my phone. So it's the third Wednesday of the month, and you know, a lot of times, again, this is not a very big clinic, but a lot of times they just want to sit and talk.
Yeah.
You know, talk about their medication. So I'm able
That's
to
good.
do that for them. I have been speaking to Kathy over there about the possibility of maybe doing like a quarterly educational program. But that's kind of in the works right now.
Community-wise, do you have some thoughts about what you do in other communities, that health promotion that you would like maybe bring into this community? What were your thoughts?
Well, you know, it's very interesting. So I recently finished I mean, if I was just targeting the Council on Aging, it varies by community. Some communities want me to target across the lifespan, and some communities want me to focus just on the Council on Aging. So I think here would probably be just the Council on Aging, but I don't want to put words into anybody's mouth. But I would, you know, I just finished up doing a Parkinson's program, and that was very well received. You know, I think a lot of times having a Parkinson's support group where people are able to talk and share their feelings in a non-judgmental environment is good. We did therapeutic West African drumming, and they loved it. We had a neurologist come, a psychiatrist, speech and language pathology, yoga and breathing. So that's something that I would, if there was a need to replicate. But I think, honestly, just doing a program about, if we wanted to look towards February, heart health, fall prevention, medication adherence, cooking on a budget, things like that.
Okay. So maybe you can throw out an email with some ideas, and we can,
So we also have we have our own bulletin board too out there too.
Yep, and we
so-
talked about that. So I can, I can either, what I've done in other communities is I do either a monthly or bi-monthly big poster of the health-related topic of that month, because monthly there's different topics that correlate with that month. So we could do, or I could just have different brochures, whatever you think is best.
how about social media? Could you
Oh.
put something on the Board of Health website, educational-wise, that people could, if they go into the Board of Health, they would see, like you said, it's Heart Month, or it's Breast Cancer Month, make sure you get your screening, or Prostate Cancer Month, or whatever, just to remind people about those things, if they,
We can do whatever we want.
yeah.
It could also just be a link to something, doesn't necessarily have to be a document you produce at all, just
Yeah.
links
Okay.
would be fine,
Yeah.
too.
So would that be, because I don't have access to it, so that would be something I
that
would send to you?
Yep, exactly.
Okay, all right, so I can start that in January?
Sounds good.
Yeah, that'd be
Okay,
great. Yeah,
I'll
if
do
you have
that.
anything, you say, oh, this would be a good addition to your website, this link or document, so we can add that.
Okay, and question, do you know what kind of educational program they do in the schools around prom?
I do not, do you, Steve folks, know?
Just about
No.
around sobriety and things like that? Do you know if they do any programming?
I wonder if the
Michelle
police does.
Yeah, Michelle
Palladini.
Palladini, she's our.
might be the one to
Yeah,
ask.
that'd be the person to.
She's
Or else-
our resource coordinator for the schools.
Plus also the nurse at the high school, because it's a regional high school.
Okay,
But I don't have that person's name either. Betsy would have that, I'm sure.
okay.
That would be another.
Yeah, I
thing
think that would be a
to
good
reach
idea.
out.
For the high school, we could do, down the line, we could do a program regarding consent. I think that's a kind of a big buzzword right now.
Mm-hmm.
I know that another school that I work with did a big program about consent, and they had RAD come in. Do you know what RAD is? It's a
No.
program that police put on,
Mhm.
and it's women only. It teaches them self-defense, but the RAD program does not allow men to go into the program because they feel like they're going to be giving away what women can do to defend themselves. But I think consent goes across the board, male and female, and just talking about boundaries and ways to de-escalate, especially for kids, might be a good idea.
So maybe at another time, we could get together with the school nurse and the outreach, and Michelle Palladini, the officer that is the contact for the high school, and see, you don't want to reinvent the wheel. They might already be doing all these programs, but if we can support something like that, I think this board would certainly support it.
Yeah.
In your other towns, does the Board of Health work with the Council on Aging to basically provide these kinds of services?
Well, a lot of times, if I do a program, it'll say, Board of Health in partnership with Council on Aging, or Board of Health in partnership with Park and Recreation. Excuse me, Park and Recreation, just to get the board's name out into the community, I think is really important. So when I do the advertising for it, I'll have the Board of Health emblem and whoever else I'm working with.
And so, last question. As far as emergency preparedness, because I was at a workshop with you, and it sounded like you were the point person for an EDS clinic in Walpole.
Yeah?
Is that part of how you could help us here in Norfolk as well?
I'd be happy to look at the EDS plans. I never got the name for you of the gentleman that I talked to you about.
Oh, yeah.
Yeah.
Yep.
But I'm happy to take a look at the EDS plan and, see what can be improved.
Yeah.
How
we're
we can
actually gonna
improve
be
it.
working on that next week.
Yes,
I'm sorry, what?
we're working on it.
Yeah, we're working on it next week
Yeah.
together, so.
Okay, well, if you want me to try to join in on the fun, I'd be happy to.
Okay.
Just send me an email. But yes, and that's what, when we talked about being the point person for the EDS plan,
Yes.
that's why the flu clinic is a really good place to do
Yeah.
the disaster drill.
To get
So we all
started.
know who
Yep.
is under us.
But if, hopefully it would never happen, we did have to open up an EDS clinic. Would your name be one of the people on the roll for opening up, being a
Yeah.
part of the clinic? It would?
Yes.
Okay, that's important to know. Thank you. Okay.
Any other questions?
CDS mean, I'm sorry, I know about it.
Oh, I'm sorry. Emergency dispensing site. If there was,
Drug overdose?
no, we're talking about if the whole community had to be vaccinated or had to receive antibiotics for anthrax, or vaccination with a avian flu outbreak. So it would be community-wide. We would have to open up a dispensing clinic to do that.
And we usually just want to expedite the process so we don't have mass amounts of people in hysterics.
Yes. Planning is key.
Exactly. Exactly.
Preparedness. Thank you.
Thank you very much. We
I'll
appreciate
listen.
your stopping by.
Oh,
Yeah.
thank you. I had no idea I was going to be on the microphone.
Sorry about that, I know
The
it.
town is
I think they just the COA just hired a new director.
Good. Okay.
So, I don't know who it is, but I think they have a new director, so
Okay. Good.
that'll be good.
Yeah. Yeah. Alrighty. Thank you guys.
Good, thank
Thank
you,
you. Very
Alyssa.
informative.
All right,
Thank you.
same to you.
Thank you.
Send me an email so
Okay. All right, yeah, I'll let you know.
Okay, great.
Yeah, I have that back. Thank you. Thank you.
Next on the agenda, Dr. Harbin.
May I come forward here?
Yeah,
Yes,
why don't you have a
yeah,
seat over
grab a
here?
seat.
That way we can
Great,
easily hear you, and so can the rest of the town.
great.
We hope lots of people are listening.
Is this broadcast?
It
It is.
Cable TV.
This was up here. This is great. I'm Dr. Lester Hartman. I'm the senior pediatrician at Westwood Mansfield Pediatrics. I've been in practice 32 years. I went back to school in 2011, 2012 at the Harvard School of Public Health to get my master's in public health and health and social behavior. It was the toughest job I ever loved. So I realized the inflexibility of a 53-year-old man's brain at the time, being the oldest in the class. I've been before your board before, years ago, and I want to thank you for being one of the towns that pushed along the Tobacco 21 bill, which is effective December 30th, which will include restrictions of vape in places that are also tobacco and pharmacies as well, not accessing tobacco products anymore, selling them, as well as going to 21. I'm here today because the industry, Joule in particular, but Joule's not the only one I'll show you, that now has morphed in a way that is really the worst epidemic I've ever seen in my 32 years. This is the worst virus I have ever seen. It has hit, some estimates say that with Joule, 70% of seniors in high school have tried Joule. At the present, 22% are using regularly, which is highly likely they're addicted now. And that is a deep concern to us as pediatricians as well. And I forgot my statement today that I was going to bring from the American Academy of Pediatrics. But as you know, I've been to 172 Board of Health meetings now, nothing compared to what Sarah has, I'm sure. But I'm here to discuss the next thing is putting flavors, restricting them to smoke shops only. Now, I don't believe Norfolk has a smoke shop, which is great because then you can get it out of the convenience stores as well. Exempting, unfortunately, for now at least, and I say for now, mint and menthol. Because of legal precedents, when in 2009 they took out all, they banned regular flavored cigarettes, yet they continued to allow mint and menthol at that point. But this is all being reconsidered through the health community. San Francisco and Proposition E, which passed the referendum, which R.J. Reynolds pushed, passed 68% to 32% to ban all flavored products from the city limits of San Francisco. And we in Boston need to set an example for the country as well, since we're always in a bit of competition with California and who has the better public health. I've never seen the number of kids who know about it or have used it in my 32 years of practice of anything. This little device called a Joule, J-U-U-L, has been used, as I said, to about 70% of kids in high school. This product is basically a closed pod-based system. Right here is a pack of cigarettes, 59 milligrams of nicotine in there. In conjunction with this, this is touted to be healthier than tobacco. It may be less dangerous, we don't know that for sure, but it is no healthier. I can reassure you of that. But that's what kids have been misled to think, as well as water vapor. By the way, if you don't know, Joule has been rated by the FDA because of its practices it denies to youth. And the mass majority of its profits of $2 billion last year were by far from kids' use. Only about 5% of people who even bother using this are attempting to use this, and it's still questionable in the validity of if it's helpful, attempting to use this to get off tobacco. And frankly, in my opinion as a pediatrician, the success rates of getting off tobacco are so poor with, it's about 4% when people do on their own. When they do nicotine replacement therapy, it's about 8%. So most people never get off this stuff anyway. The key is preventing access until about 21. What age can you rent a car? Do you know?
21.
25. Interestingly enough, when the brain neuroscientists went to the car rental industry and asked them why they did that, they said simple, crash rates don't drop till 25. And yes, you can start at 21, but you got to pay a lot of more money than you used to, okay? But at 25, so what they said, what are crash rates a measure of? Judgment. Where's judgment in your brain? Frontal lobe, prefrontal cortex. When they did serial functional MRIs of brain, they discovered that the brain doesn't fully develop the frontal lobe till 25. Hence, the seat of judgment doesn't fully develop. That's exactly what tobacco knows and uses convenience stores as the conduit. It's not the convenience store's fault. It's the tobacco industry making them dependent upon them for a large amount of their income. And I really don't care about compliance rates by stores. The evidence is it's out there in schools, and the evidence I'll show you here is not because of the internet. 75% in a survey of several thousand kids, 75% of the kids chose going to local retailers, brick and mortar retailers. So in this right now is liquid nicotine, propylene glycol, which is antifreeze, which I go to smoke shops and I talk to the people in the smoke shops and try to learn about all the different devices. There's another one coming on now called Vegan that I can tell you about that I just heard about yesterday. Also, I've been nominated for the Governor's Council on Vaping the Commission on Vaping just recently by Children's to be one of the people. This is got propylene glycol is car antifreeze. Now it's FDA approved to eat, and it's misleading because kids assume when you eat something you can breathe something. Okay, I can eat a steak, but I'll die if I try to inhale it. And also the flavorings that they have on this, such as mango. There have been several kids who have ended up on ventilators, intubated, because they have an allergic reaction in their lungs called eosinophilic pneumonitis, which I speculate could be anything. It could be mango, because people are allergic to mango. We don't know. Could it be a chemical they're allergic to there? Yes. But imagine having hives in your lungs instead of on your skin. That's life-threatening. Also, the metal in here, while they use a stainless steel center, around it is nickel and chromium. Those are carcinogens by far in and of themselves as well. And that's a major concern. There's clear data now from Stan Glantz at UCSF that e-cigarettes double your risk of heart disease right now. There's emerging evidence that this may cause emphysema as well. I have kids who have tried to get off this stuff, and they've had withdrawal symptoms. Serious, serious headaches one guy had for 2 weeks trying to get off this stuff. Kids think this is healthy. They think it's normal to use. They think it's benign, and that's what they've been indoctrinated through social media with this. And as you can see already, as you have up there, Sarah, is it 136 or 138 now? I wasn't sure when I was looking at the last, because things are moving pretty fast.
They are. I don't even think that we have an accurate count.
Yeah,
but,
I emailed GJ, but he's away.
No, he's
but,
away.
But anyway.
136 is what I've got.
You've got
I think
two,
it's
okay.
probably closer to 140.
Yeah, and have joined this and have restricted all flavored 21, except mint and menthol, to 21 plus smoke shops and vape shops. You have 3 towns around you, I believe. My poor eyes. What border you now? Walpole.
We can see it now.
All right,
Right
Joe.
behind you.
Yeah, well,
Yeah, Walpole, Millis,
And
Medfield,
yeah.
Medfield have all gone to this. Foxborough is strongly considering, and I just did a petition by the parents there, that if we have 600 patients in Walpole, we have about 100 here. 650 parents, 221 signed a petition that wanted flavors restricted to smoke shops only. And I suspect if I'd sent a petition to get rid of all flavors, they would equally have signed that as well. So I think Foxborough's probably going to go. Sharon's probably going to go. I hear Stoughton may go. I've been to those towns. And Mansfield is considering, and it'll be the spring before they tell us anything definitive. Franklin is slow to move on this. I've talked to the healthcare agent. I've sent a petition also about 40, 50 Franklinites there, and they're working on it as best I can. But we need to close the gap to get the bill put in by the state, as we did, because the more towns that work at the local level to get this done. And I was with Senator Lewis yesterday, Jason Lewis, the head of the Public Health Committee for the Senate. And he said the more local towns do this, the more we're likely to do it. At the present time, Sarah, how many are 21 now? It was 176 the last I saw, but then it's really taken off.
We're trying to get as many towns as we can before the end of the year.
Yeah.
So we think it's about 198 to
Yeah.
203.
And there are 356 towns, but with that, you're having about 80% of the population. Because 2/3 of the population is Worcester and east. 1/3 is to the west of Worcester, even though the landmass area looks much bigger. They're much less dense crowd and group of people. So the final thing, the other thing I want to talk to you about, the vegan, I don't have a vegan with me. I'm purchasing one at this point because I just found out it by a toxicogeneticist who presented yesterday at a conference on what vape could be potentially doing to kids. This is called the Sorin Drop, the second most common one. in schools now. Almost all the kids know what it is. Remember I told you this was a closed pod system? You get 5, 6 different flavors, creme brulee, mint. And let me also mention something to you. Joule has just jumped out and said, because the FDA is getting on their case to a point, oh, we're going to suspend, notice the word, suspend flavors to convenience stores, okay? That means suspend, not permanently stop, not permanently banned, except mint and menthol. Now, the FDA, who's a little bit too friendly, this FDA, to, I think, corporations sometimes, has said, well, we're going to stop mint and menthol tobacco, but we're going to continue to keep mint and menthol vape. All right? So to me, that accomplishes very little. And I can tell you, my experience with kids when they put mint in the stores right now, which we're looking at, there are several towns that are working on, in California, there are towns that have banned mint and menthol. You don't want to do that because you're going to have big tobacco and big vape right on your doorstep with lawsuits. There are people working on this right now to do this. So you would still have to keep mint and menthol. But kids' most popular pod seems to me, when I talk to kids about what flavors, it's mint right now, because that's about the only thing left in the convenience store as well. But this one is called the Sorin drop. This is an open pod system. Now, depending on who you talk to, there are 8,000 to 15,000 flavors. Crunchy French toast. And if you smell it, I wish I had mine with me today. It smells like maple syrup. It's unbelievable how it smells. Yeah, 2 teaspoons, that'll kill you. A quarter teaspoon killed a 2-year-old in, I believe, Fort Plains, New York, about 3 years ago after drinking some of this. So, and you fill this, it's a 2-side tank, so you can do things like you can put different flavors in, you can put marijuana in one side and vape stuff in the other side. You close it up and you inhale. Now, this is an intentional thing. Can you see me with anything in my hand when I make the fist? That's totally intentional, okay? This is what they're doing. They're taking it from the tobacco playbook, and they continue to do it, and they use the convenience stores to expose kids. If it's not in the convenience store, the kids aren't going to use it. Yes, will they morph to the internet eventually? Yeah. I was in Maura Healey's office just a few days ago, talking to the group. They actually are the first attorney general to sue Joule, first state attorney general to sue Joule with 15 others in the United States. She has had cease and desist put out to the 2 big internet vape distributors to Massachusetts because the age verification is absolutely lousy. Have you ever looked at age verification on these? It says, are you 18? Yes or no? Dink. Okay. Now, other people, well, we do photo IDs. Well, now I'm asking for a license, which you can still, fake, but it's harder to fake a license than it says they ask for picture IDs. Mansfield Wicked Vape does that. It says you can get with a picture ID. Well, you can fake a picture ID. This my children's ID. I could probably cut this out and put somebody else's face in it. So, I think that's a ridiculous form of thinking there's enforcement. It's up to you at the local level, and nobody's going to save more lives in this than you all, even though you do sewage and perks and all those other things. This is true public health. I take any questions.
Can I ask you one? This proposal is essentially to put these materials only for sale in smoke shops.
At 21-year-old smoke shops. And they're all pretty much going to be 21 after December. They're going to be 21 after December.
And as you observed already, we don't have any. Does Millis or Medfield have any?
Medfield doesn't. I don't know about Millis.
Okay. So essentially you're banning it.
You can go to another town if you want it. So the access makes it different. When Needham went to 21, in the first place in the country, maybe the world, to go to 21, there was a 47% reduction in use. Whereas right next door, Wellesley still had it, Dedham still had it, Westwood still had it, but access reduces it because 14, 15, and even 16-year-olds can't get it. And the younger you start this, the more likely you're to be addicted. And you have 12-year-olds doing it in your school.
Well, let's focus on the point, though, which is that effectively, if we adopt this in our town, we're banning it from sale.
You're restricting it to smoke shops, and
We don't have any.
But you do have people still have access by going to another town.
Well, that's not, forget that part. In terms of our town, we are banning it from sale in our town.
If you want to call it that, I think that's a
That
person
is
words.
the effective outcome of what
But you're a part of a greater whole too. So
Sure. But we only can do what we can.
absolutely,
Within the constraints of our town.
absolutely,
Okay. I just want to make clear that that is our situation.
absolutely. Fine with it.
Questions?
So I just had a question about if we do restrict the sale of vaping products, which include e-cigarettes and Joules and Sorens, except for mint flavor and
Menthol.
menthol. So they could still sell those two products.
For now.
For now.
But more people who do this push more people to take the chance against big tobacco. And I can't discuss what we've proposed and we're looking at, but very soon there may be some changes with this. And I can't really elaborate any more than that, because I can tell you Boston may take this up. I don't know for sure, but I know some towns that will be taking this up as well. Sarah, do you want to comment on that at all, what I just said with it? All right?
Not ready to.
Yeah.
So, thank you so much for coming.
Yep.
And we asked you to come to clarify the health risks of e-cigarettes. And so the concentration of nicotine that a young person is getting is like smoking a pack of cigarettes by
By
just
taking that one pod.
one pod. And how long does it take to use up that one
It all
pod?
depends on the kid. It can take a few days to 30 minutes.
Okay. And just to confirm, nicotine is addictive?
Absolutely.
Okay.
And a couple things, too. Nicotine can go to nitrocamine. Nitrocamine is a level 1 carcinogen. An example I give that's very upsetting to me that may be related, and of course nitrosamines were in things like cold cuts and things like that. My wife got bladder cancer last year. Her father was a 3 to 4 pack a day smoker in the first 21 years of life. Smoking is the gift that keeps on giving. And unfortunately, there is good data to show that tobacco and probably nicotine causes bladder cancer. So you have to remember, heavy metals also, which are in these things like nickel and chromium and the vapes products, lead, because they're not regulated. They're often made in China. Although when you talk to Joule, they do everything healthy. They're a big cause of strokes and heart disease because damaging the arteries isn't just from cholesterol. Only I don't say only, but only 1/3 of heart attacks are related for sure to cholesterol. 2/3 are not. And air pollutant with heavy metals is one of the major causes as well to it. So you're seeing that heart disease may go up with this, will go up. Nicotine is also associated with type 2 diabetes, contributing to an increase in type 2 diabetes as well. So there are a lot of health factors, and you know what? We don't know exactly. There's something called acrolein, which is in glycerol when it gets heated too high. Now, some people, it's only in combusted. Acrolein causes what's called alpha lung. And if you go on the vape sites, I go to vape shops all the time and look at what they're saying to kids, and then I post my videos to theirs. I've had some choice names back at me as well. They tell people, well, it's not at dangerous doses because it's not as high a dose as what they get there. Nobody knows. Do you want to take the chance of exposing yourself to acrolein and diacetyl and acetaldehyde, which we know is a carcinogen, and formaldehyde, which propylene glycol can go to if it's heated too high.
So are you saying that this industry has not hasn't done any research, animal studies to show that these chemicals that are...
We can't trust what animal studies they do. This needs to be an independently performed by the NIH, not by Big Tobacco, because every study they've done is totally biased to what they're saying. I mean, that's just the way it is. And if it's funded by the tobacco industry, you can't trust it. Just like when I read the New England Journal, if I find a pharmaceutical company funded an article, that doesn't give me any validity to it as well with this.
Jeff, any questions?
No, I mean, thanks for coming in. Very interesting information to hear that. Interesting from a medical point of view. About time we've actually heard something that says some of those issues inside those Joules or whatever actually do cause damage beyond just the nicotine part of it. Every time that we've broached the subject of restricting something with the cigarettes or the e-cigs, we have a small enough number of retailers in town where we can typically reach out to them almost directly. We haven't really had any pushback yet in anything we've done. And so we could always, again, look at this and reach out to them almost individually and see if there is any pushback.
And you may get pushback. I mean, I've just been in Stoughton, and we had quite a battle. I had quite a battle with about 3 or 4 other, and so did Sarah's group had quite a battle with them about this, because their emphasis is we're on our compliance checks are so good. It doesn't matter to me if 70% of the high school is using this stuff. And by the way, King Philip was on CNN.
Yeah, we saw that.
And King Philip continues to be that bad.
I think just about any in the area probably.
Absolutely,
It's more of a,
but it seems to be sustained a little more in King Philip. I don't know why, because I know it's a regional high school.
a town like Stoughton's going to have a lot more retailers. That,
Absolute tons.
Right.
And we dealt with that. I mean, when you send petitions out and you get parents to talk, that kind of silences the retailers a little bit, because the power is the people of the town, not the retailers who may not even live in the town. And I'm doing this for that much money. This is all I get, nothing. So my motive is purely for the kids.
Yeah, no, it's appreciated. I think we can
Well,
talk about that.
can I just
regulation.
comment that we have had pushback from the retailers, because we've had the head of the retail association.
But that's more
come
generalized,
twice.
wasn't necessarily brought by one of our retailers calling him in. It's someone who wants to curb that happening in an area wide.
Well, they're often called in, and ironically, Stoughton is a place where, what is it, NACS? And that is funded by Big Tobacco. I was talking to a lawyer, Mark Gottlieb at Northeastern, and I can send you the literature, but they send people out, and I see faces all the time, the same faces over and over again.
Yeah.
And their big emphasis is on compliance checks. It's not our fault, it's not coming from us. Well, there's a lot of leakage.
All right, we have some other things to do here. Let's take one call or, Yes,
So I
please,
actually
please.
represent 2 organizations, the Coalition of Responsible Retailing and the New England Service Station and Auto Repair Association. And I am here to provide
we
some...
need you to get a microphone. So folks at home can.
Oh, you have one? Okay.
And they're funded by Big Tobacco. I have the data from Northeastern, if you'd like me to send it, Mark Gottlieb. The organization he's working for is funded by Big Tobacco.
I do not know if that's true, and I
Actually,
have
it
not
is.
seen that documentation. Okay.
I
would also just mention that, I said nothing during the presentation. I would expect other people.
Yeah, go ahead. I'm sorry.
Go ahead.
So-
I don't like
Go ahead.
hurting kids.
Straight on.
So anyway, I represent those 2 organizations, CRR and NASARA, and their interest here today is in protecting the local convenience stores and service stations that might sell some of these products. And their position is that the potential or proposed regulation is unreasonable, and the reason I use the word unreasonable is because the governing statute that vests this board with authority to propagate
We can't hear you.
Sorry, the governing statute that vests this board with authority to propagate certain regulations requires that those regulations be reasonable. And the reason that we believe they're unreasonable is essentially threefold. First, we believe that they're arbitrary because you're essentially selecting a certain class of tobacco products as opposed to addressing them across the board. So not only are you addressing e-cigarettes, you're addressing an even smaller class of flavored e-cigarettes, and you're only addressing as well a certain class of stores, convenience stores, as opposed to stores across the board, which would include stores that are 21 plus. So for those two reasons, we believe that the regulation is arbitrary. And that brings me to my next point. We believe that the proposed regulation doesn't actually logically achieve the end it seeks to achieve. So both of those classes of stores, both the convenience stores and the 21 or older stores, are already governed by the same law, which requires that they prohibit the sale to minors or to individuals who are under the age of 21 as soon as that law comes into effectiveness in late December, I believe. So they're already required to make sure that that doesn't happen. And in Norfolk in particular, since 2013, not a single instance, according to the FDA data, there hasn't been a single instance of a sale to an individual under the legal age, right? And so I understand Dr. Hartman's point where compliance doesn't matter because there's evidence that these things are in the child's possession. So we would suggest that if that's the case, if the compliance data says these aren't being sold directly to children by these stores, yet children still have them, then they're getting them by some other means, whether that's an intermediary, someone over the age of 21 buying them and handing them to the children, or not children necessarily, but individuals under 18 or under 21, or through the internet. In either of those
Quiet, please.
in either of those two situations, or in any other situation where these individuals are getting the products by other means, the much more targeted and effective way of preventing that from happening is enacting purchase, use, and possession laws to actually
denies and doesn't want it.
Please, doctor, keep it down.
would actually allow either the police or school enforcement authorities or similar individuals with authority in town to take those products out of the hands of the children. And so if you don't know how the children are getting these things, and I should stop saying children because people under the age of 21 are not necessarily children. If you don't know how these people are getting these products, then the most effective way of removing the products from their possession is doing it directly, not picking a sort of random class of store and a random class of product within that store to try and address a much larger issue that the board is facing. The final point I want to make is that it does affect the bottom line of these local stores, especially in a town like Norfolk where there are no smoke shops. So you're essentially saying none of our local businesses can sell these products, and you're taking a significant portion of their business away. And I do understand that it's not the board's job to protect businesses. But when there's no rational basis for the regulation itself, and the only practical effect is to harm those businesses, I would simply suggest that it behooves the board to take that into consideration.
All right, thank you. We have heard these arguments before, so thank you for conveying them again. At this point, we have a room full of people here for other business, so I'd like to thank both gentlemen for your
Thank you.
presentations.
Thank you.
And we will take this up.
Thank you.
Thank you
And I'm
so
happy to
much.
come again anytime.
Thank you, Doctor.
Thank you, Dr.
All
Hunt.
right.
Approaching 8:30.
That's pretty.
So it is a little past 7:30, but I would like to bring us to the next item on our agenda, which is a discussion of 17 Lawrence Street and the public involvement plan. We welcome our town planner,
Thank you.
and please, move forward, Frank.
Paul, there's another spot up there if you want to grab a seat.
Hey. Yeah. Good, Howie. Nice to see you again.
The board welcomes Frank, and
My name is Paul McKinley with Weston & Sampson. I'm an LSP as well.
Yeah, I brought Paul here tonight. He's local. He's out of our Foxborough office and much closer to the community and the site. Paul is an LSP, same years of experience as me. Just in terms of access to Norfolk, it's much easier for Paul to come to the town, but we would definitely be collaborating as we move forward on the site.
Sure.
Where we're at?
The scope of work, I'll call it maybe the second scope of work. I think the funding for that was approved at the November 27th town meeting, which I'll just briefly run over the tasks, which you already have been forwarded, has been signed by the town administrator, attendance at future PIP meetings, review of the draft MCP documents, risk assessment review, split sampling of environmental samples, teleconferences, meeting, communications with the town, and then there is some other, we talk about on the bottom here. I think that's it, right? Yeah.
Oh, the
So-
down gradient.
Oh, I'm sorry, that's right, yes. And then the addition from the previous time I was before the board is that we added the down gradient property status. So that's been added to the scope of work. So the signed scope of work right now is at $38,100. The funding was approved by town meeting, November 27th. So that's and obviously Weston Sampson will continue with the work. There's a funding in place. And like Frank had mentioned, Paul's here tonight to help. The idea is to have somebody more local to kind of pitch in, since, as you can see, there's a bunch of meetings involved. They're local and they will collaborate. So that's kind of the overview of where we are with that. As far as the the PIP itself, I don't know if you want to
Sure.
comment quickly on that.
Well, are there any questions on the scope of work and what it covers and where it brings us? I can give a little more.
What we talked about last time you were here as far as
Yeah.
enhancing some of the some of the items, including the downgrading property one. So it sounds like it's just been handled, which, so the initial scope looked a little low for some of the things you had discussed, so makes
Right.
sense.
Right. So it brings us out, like, as far as the MCP timeline goes, we have review of the phase 2 scope of work, the final phase 2 scope of work, the comprehensive site assessment, which is the report that they generate after they do their site assessment, and then the phase 3, which is where they start the remediation planning. So those documents will all get reviewed and commented on. And then the downgrading property status we talked about, but that just protects the town because we're worried that some of the contaminants may have washed down the Mill River and may be settling on the town properties downstream.
Mhm.
So we have budget for that as well.
In terms of the timeline you were just talking about, do you have a feeling for what kind of timeline we're talking about?
So it's, typically you have up to 3 years to get the phase 2 comprehensive site assessment, but this site is reopened, and I'm not sure, and Paul, I don't know if you remember what the...
Under the tier classification, it was 2 years. I thought they had to, with the new, when they reopened under the reopening and then the new tier classification, they had a 2-year window, I think, to resubmit.
Glad you came.
What's just in the schedule for additional sampling? Where do we stand with that?
I don't have an update. What I do know is that there were very comprehensive and excellent comments received by the PIP group. I had met with Steve Viteri to talk about the comments and kind of the differences of where we recommended sampling, where the community group wanted to see more sampling, and what they had presented for sampling. We acknowledged that there was more sampling that the town and the town folk had wanted. Steve had gone back, and I think he did add, he's preparing, I don't believe that he has prepared, a new phase 2 scope of work for the additional sampling. So right now we don't have a definitive answer in terms of where and how many samples are going to be taken.
So are they pushing back as far as trying to
No.
limit the number of samples at all?
I don't think they're pushing back. I think what was explained to me by Steve is that we have to meet the requirement of defining where the contamination has come to lie on that property. Their initial line of reasoning was that they wanted to go out, take some samples in an iterative fashion to see, instead of going, 1 sample, 2 sample, 3 sample, like kind of in rings going out, they wanted to do the 1 sample first, get the data, then see where it was. So 6 of one, half dozen of the other, but ultimately they have to comply with the regulations and define the nature and extent. So it's really up to them how they proceed with it. I think the perception is, when they come forward with lesser number of samples, that they're going to walk away after that. And they really can't regulatory-wise. They have to meet the requirements of the MCP, which is defining the horizontal and vertical extent. So that was what we discussed in our meeting, and like we were talking about today, even in the PIP process, typically, all you have to do is respond to the comments, and then they can go ahead and start with their phase 2 and the assessment. They don't need to prepare a new scope of work. And I think it's really good that they are, and they're showing that they have concern for the community's concerns and doing additional sampling and trying to come to some middle ground to get to that sampling.
Is there a set vertical limit for the sampling? Are they trying to get to the bottom initial layer? And obviously they're going to go through whatever cap's there, but are they trying to get to where this initially could have been buried? What's the typical depth? I mean, is that discussed? Is that worked out between you folks? Or?
So typically in soil, you're chasing the contamination vertically. Usually when you get into the groundwater table, you kind of stop because at that point it's in the groundwater.
Yeah.
So you start evaluating the groundwater. And I'll let Paul also talk to this as well, because different LSPs may have different opinions. But and even sediment, like the wetland sediment and some of the lagoon sediments, that's really not even covered under the MCP. Sediment is really not, you go into the the Wetland Protections Act and whatnot. But if there's risk to ecological receptors, you have to clean that up. So, but they are going deeper. They're taking some deeper 2 to 3 foot, I believe, samples in the sediment to evaluate, if, they were cleaning that sediment out, taking it out, but maybe it was only the top 6 inches and the deeper sediment is really contaminated.
So when you're saying 2 to 3 foot sediment, that's the original sediment before it was capped, is that?
It could be. It could be that they've always just skimmed off the top 6 inches or top foot or 2 feet, and that bottom sediment layer may be really impacted. Now, we had talked about this with Steve and with some of the residents, that if that stuff was really contaminated, you would see it in the groundwater. It would show up in the dissolved fraction in the groundwater. And to date, we really haven't seen very much in the groundwater aside from some arsenic, which most of the LSP's opinion is that it is most likely naturally occurring because that's pretty typical in bedrock aquifers. So.
Questions, Fran?
Well, I just would like to remind the board about a letter that we received October 15th from the Friends of Lawrence Street, and they had 10 issues that they felt were health concerns. And I think you reviewed this, Rich, and you reviewed it, and you brought to our attention that comments 3, 4, and 5 that the board could request the zoning board to address on the permit, the 40B permit. So I think that's what, to me, is most important for this board that we could do tonight, is decide. I can go over those 3 things that the Friends of Lawrence Street were concerned about in this.
And these are additions they want to the permit?
Yes.
Rich, what's the status of that permit?
So the public hearing was continued to tomorrow evening,
so it's still open.
December 5th. However, I heard later today that they're going to request another continuance. And
So there's still time to get in.
so there is time, yeah. So the last time they were before the Board of Appeals, you didn't actually have time
Right.
to meet. So that's why we moved it to tonight, for you to be able to review those 10 points and discuss and make a recommendation what you want to do to report to the Board of Appeals. So the short story is you have time because we have tonight, obviously, but it also is going to be continued as well. But I think for tonight it makes sense to kind of go through them and we talked about discussing those points, and then we could have Frank with his guidance and Paul, draft a letter that would go to the Board of Appeals.
Betsy, do you have another copy of those, by any chance?
Well, I have a copy here.
Maybe just go right down the list, Fran.
Okay, so, well,
You have it?
I don't want to repeat everything, but from Rich and Frank's review, they indicated that comment 1, 2, 6, and 8, and 10 are being handled through the PIP process. And then comment 7, there's a meeting set up with the LSP and Sandy.
What are those numbers again?
We'll call up Betsy's going to, it is on the server, so we'll call it up so you can see it too.
Okay.
All right, all
Okay.
right, all right.
That's
But you've already
fine.
reviewed all these and you've come up with your
Yeah.
recommendations.
For the benefit of the board and the audience and the viewers at
Yeah.
home.
And if you would quiz me right now about what each answer was, I probably could have.
Well, we'll refresh her up there momentarily.
So why Betsy, oh, there. Is that it? Yep.
Yeah, the left
That's
side
it.
there.
Yep.
Usually page width is good. View page width. That'll go across the- to the right. Further right. See page width right there?
So we all get to,
Yep. That'll look bigger so you can see.
So
Was
your
it targets?
review, I don't know if you want to hear what your review was, so you don't have to go through it all. But what you said was that 3, 4, and 5 are Abbeville 40B permit comments that the Board of Health can request the ZBA address. 3, 4, and 5.
We actually did talk about dust monitoring quite a bit at the last zoning board of appeals and what we would recommend for perimeter monitoring and dust control. So we kind of already talked about that with the zoning board. So I think it's entirely appropriate for the Board of Health to further recommend these types of comments for the zoning board.
Just for my clarification, dust and air pollution from mining operations, that doesn't mean blasting. That just means digging. Yes?
I mean, I don't know technically the definition, but in my mind, I think what Sandy was meaning was the mining of the gravel out of the site.
So just digging?
Yeah.
Okay,
Yeah.
It's mining when you remove it.
okay.
Yes.
a lot of digging.
A lot of digging, okay,
And trucking.
Okay.
And trucking.
okay.
And on Park Street.
And then noise pollution from mining operations and trucking. And then the last one is 5, which is request perimeter dust and noise pollution monitors. So, and I think those are reasonable. A health concern that.
Sure. And, you know, typically what we've seen too in other zoning board or permits is, you know, no drag out of dust. You know, there's anti-tracking pads, there's wheel wash stations. You know, we can make a whole myriad of recommendations to make sure that dirt and dust from the site is maintained and managed appropriately at the site and is not coming out in dust plumes, is not being dragged out onto public streets. And I'm sure that, you know, the zoning board has language to make sure that it's happening. Now, the rub is really with the monitoring out during construction to make sure that that's actually happening.
they
Yeah,
must
so-
be within the NIPD's permit threshold of an
Right.
acre, so they must have a stormwater plan, erosion control plan, I would imagine.
They do. Well, they don't have it yet. They're still as part of the permitting process. I mean, one of the things that we talked to kind of is to really come up with some means to do this in real time so that, you know, it's not after the fact. You know, we got dust issues that are coming up that we can quickly react to as opposed to after the fact. That's where we want to kind of drill a little bit deeper, I think, as it goes forward, what those means are going to be. Because it's going to be a while if the project gets approved, this activity. And
Yeah, the devil's in the details on the dust monitoring. I've certainly had a fair amount of experience. I don't know if you covered this in the last meeting, but, you know, what are the reporting, you know, the thresholds, the site-specific thresholds that they're monitoring to? How is that reported, you know, back to the Board of Health and concerned residents? And so those sort of devil in the details on how that's, you know, reported and monitored, and as a continuous monitoring when there's instruments, you know, the dust track dues, and you can set up the perimeter monitoring stations, and they can continuously monitor at what interval, and again, what's the action level, and then if they do trip the action level, then what's the step? Is it, is it watering? Is it calcium chloride? What is the next steps to address the dust or noise if there are tripping thresholds?
Is that something you folks are familiar with as far as, I've seen plenty of the stormwater and erosion control plans, but as far as the dust monitoring, is there certain testing parameters and times and?
We don't typically recommend monitoring for anything but dust, because the contaminants are coming out, they're absorbed to the dust, and it's just, you get false positives, you get false negatives. Dust is dust. So what I typically recommend is the action level is set at 80% of what the regulatory action level is. So, you don't ever pass the regulatory action level. You have that 20% cushion where work activities stop, engineering controls are implemented, and then the dust is controlled before you can start that back. Now, some of the really contaminated sites that we work on have these monitoring stations, which are telemetry enabled, which can be accessed by the community to look at the perimeter dust controls. And it's very commonplace technology now. And for a site like this, we would absolutely recommend doing that, because then it's completely transparent and people can go to the website and see what the dust situation is like at different points around the perimeter of the site and internally as well. Wind direction is very important too, so you have to have a good anemometer to determine the wind direction, so that you can, as I've seen that tied to the dust frequency. So the down gradient wind direction, you're taking more frequent dust measurements at the perimeter. So you can get very comprehensive, you can get very complicated technically on the monitoring, but it really will be something that the community can rest that they're protected.
So are the standard industry practices as far as levels that you're looking for? And by us saying, okay, well, these are recommendations we want to implement, are we expecting the applicants, engineers to put together a plan that you guys would say this is exactly what we always see? So there's a standard that we're expected to follow? Or you're saying they're going to come back with something they just made up that might not meet what you're saying?
So
And
this
there
is
any
what we
review?
would recommend to the zoning board to put in their permit. Okay, and we can give them the specifications, because this is a private project. If it was a
Right.
public project, we would prepare a technical specification on air monitoring and dust control, and all those requirements would be in there. We would get a submittal, which is their
Right.
air monitoring plan, and we review it
Right.
and approve it. But on a private development, it really is the zoning board permit to have those conditions in the permit that they would have to then implement as a condition of the permit.
All right, so along with our recommendations for this, you could provide the
Yeah.
specs for it, so we should put something in that will be provided, so.
So as part of our recommendation, it's going to be very specific. I mean, we're going to sign something that's very specific.
Yeah, we can take those three
4,
items
5.
and then give you the permit language that should go with each one. And a noise control plan is obviously something. And we have a lot of this language already developed, so it's pretty easy for us to pull it.
And can
It's
we-
really just getting the frequency, the locations, because typically we want to get input from the community group as to where they see the most sensitive areas to monitor in terms of where their residences are and stuff.
So, Rich, do we need that before they close the hearing, or they just need to know it's coming, that we're gonna, we want that in there, and then the specifics will be ironed out later, or?
I would suggest that a letter would come from the Board of Health to the ZBA that you want to have included these three items to be addressed,
Mhm.
and it would be, if we can do this timely, we can already put in there what we want to see, so it goes right in right from the beginning. If we don't have that, at least get it to say that we want these three items addressed, and then we're going to follow up with more specifics for which we want incorporated into the permit.
Yeah.
So, the next meeting is a month, or
Yeah, I think.
is that enough time for you folks to put that together, or do you need?
Oh, yes. Sorry. I was already making plans for pulling it together. But, we'll probably
That
ask
work
to
for that?
meet with the community group with the layout of the site and make sure that whatever we recommend is something they would like to see.
That work, obviously you're working with them as well, so you.
Correct, yeah. I think, and probably and maybe the next, I don't know what they're going to talk about next, actually. We're probably a little bit ahead because they're not, I think we got time. At least
Just
put it on
one way
I want
or
to put
the
it on the
other.
record,
Right,
Yeah,
okay.
so
So in our statement to the board, we should at least say with specifications that we will supply or something like that, so it's
Yes,
it's in there.
yeah.
Okay.
The biggest point for tonight was that we wanted
Put it in there.
give the Board of Health the opportunity to say, okay, these are issues we believe should be addressed, and put it on the record so that it gets incorporated, so we didn't want to kind of miss that window.
And we'd have to coordinate too with Tetra Tech because I think as part of the site civil, they would come up with typical dust control measures, but because this is also including part of the disposal site, you know, or may include part of the disposal site, we want to make sure the contaminants are, you know, are considered. That's why we're going to this level above, you know, what typically is done on a clean site.
Right. So we probably
Does this
wanna-
change your scope of work too that you just put in for? Is this?
You know, we don't really, I mean, we consider this part of the meetings and responding to meetings, so.
But as far as putting the specifications together?
Like I said, you know, hopefully we can pull from other sites that we've already done it quickly. If you know, we have a lot of requests for very specific things to put in there, we'll let Rich know, but
Okay.
we don't typically try to go back and forth. We have a scope of work, we'll work to that scope and make sure everyone's happy.
We have a question from the audience, and you need a microphone to talk into, so go ahead.
I'm Ron Ober from Main Street, and just have a question regarding when and if these three items are implemented. There's a cost associated, obviously, with all of this. Who pays for it? Is it the town? Is it out of our pocket? Or is it out of the contractor's pocket? Any questions about that?
Care to address that, Richard?
Sure. My first take of this would be as part of the responsibility of the developer to pay for that. Now, I suppose if you know, they raise objections to some of this stuff, then we might have to figure out a pathway after that. But at least initially, it would be the developer's responsibility to pay for it.
Hired by the developer or hired by the town?
By the developer. Yeah.
With the town reviewing submittals that come in.
Yeah, sure. I mean, the developer would typically implement these, and then we would review with the results. So, you know, and as part of developing, we'd probably give them performance-based numbers. You know, you need to hit X, Y, and Z. They would have to come up with a plan, or we could give them guidance on sort of where the monitoring stations are, and then they would have to implement this, and we, you know, we would review the data and make sure they're hitting the performance metrics on this to limit the dust and the noise. So it'd be full. It would be on the contractor to hire, either do it themselves or, you know, hire somebody to do it for them.
Where do you foresee these monitors being placed or established? I don't know anything about it.
I mean, typically it's done on the perimeter of the site, so you know,
How about
so
the other 200 houses that they have to go by on Main Street with their tops over?
So that's where the monitoring comes in, right? Because we want to make sure that the trucks, when they're leaving the site, are cleaned and they're not dragging dust out onto the street. So the developer would typically pay for dust control and monitoring, and then, you know, maybe as part of continued services to the town, you know, we have some oversight, or the town has someone in DPW, you know, because someone has to watch and enforce it.
Correct.
So
I agree. You know, obviously.
we've had, you know, typically during construction, we put a resident representative, either part-time or full-time on some of these other, you know, if it's a remediation project,
Right.
we would have full-time oversight. But on a construction project where it's nuisance dust, and I'm guessing that's really 90% of what you're going to be talking about, then it's really up to the town and what they want to do for monitoring, to make sure that those types of nuisance situations aren't occurring, because that is really the worst, and I understand that.
I know we have discussed dust. There's another facet to this environmental protection as the trucks are flowing every 4 minutes, by the way. I don't know if you saw that statistic. Every 4 minutes for 6 hours, am I correct? On 8, excuse me? For 8 years. For 8 years? Yeah, okay. So that's quite a bit of dust. One other little thing that's a health problem is, and you got a little preview of it happening right now, every day, from 10-wheelers, 18-wheelers coming out of Park Street. And I can only assume that they're coming from the Rentham project, okay, traveling the same route. So we have a little preview of things to come. And I mentioned this at a prior hearing, not with the health Board of Health, but I just can't get it through my head why they need to use the common term is Jake brakes, so to speak, otherwise known as engine brakes, coming down Main Street. So I'm sure they do it before the Rotary tour uptown, you know, and then they come down past St. Jude's to the intersection, the dangerous intersection, as you know. Probably gotten a little better since those signs were up, which is great. But anyhow, when they hit those Jake brakes today, you know, and these are trucks from all different companies, okay? And I realized that Tommy DePlacido did say that he was going to put very highly visible, identifiable signs on the backs of the trucks for our benefit to report these things that we all talked about, you know. So take a little look at Main Street. I've done a quick cursory trip up Main Street from the intersection, or even beyond it, from the prison, almost to the Franklin line. There are 200 houses involved, not just on Main Street. There's like 80. But then you start adding the people who are trying to get out onto Main Street. And believe me, those are all health problems that will be forthcoming, I believe. So you're on the right path. I just need to get a little assurance of a couple of those things. That's all. So thank you.
Okay, thank you.
We can make a recommendation, signage for no Jake brakes. There's no significant hills on Park Street that they would need that for. I mean, it's more just a saving wear on the trucks.
I can't hear you. It sounds...
No, I'm just saying, we can make a recommendation that there's no Jake brake signage be put up. I mean, something simple like that. It's a noise issue. It's a
Oh,
noise
yeah,
concern.
at the last, one of our last hearings.
And trucks usually start
Mr.
up sometimes, before 7.
Yeah, one of the selectmen thought it was a great idea, and he'll get right on it.
Well, we can just put that in the note too. I mean, just so
Haven't
it's
seen any.
carried over, the recommendation.
Yeah,
I
they
mean,
ought to
it's
start
a
now,
noise
put them
concern.
about every, 100 yards or something like that, or 500 yards.
I don't know, well, I don't know the
Whatever
standard.
it is, whatever it is,
CD
but more than
standard for
one.
signage on those, but we can at least put the recommendation in there.
They just love, I think the whole reason for it is,
It just save wear and tear on the brakes.
so they say.
Yeah, I mean, there's no
These
significant
cowboys
hills
that
on
are
Park
driving the
Street.
trucks like to hear it. Absolutely. Absolutely. It was brought up in a trucking business, so I can tell you what they do.
Right.
Right?
Add that in, item number 11.
There you go. Okay. Thank you.
Thank you. Any other comments on items 13, 3, 4, and 5 from the audience? Yes, there's at least one more.
Ann Middleton, Brett's Farm Road, Norfolk. Can everyone hear me? Yep. I'm wondering why all these trucks from the Rentham, anyway, the Rentham project, why are they going through our town? Why are they not going through out to 140 to Rentham? Why do they have to come through the small town of
We're just a
Norfolk?
teeny bit off scale here. We are focusing on 17 Lawrence, so we do control that one.
Okay,
Why
fine.
those trucks are
Fine.
going the direction they're going, it's got to do with where that stuff is going, which we don't really have much control of, unfortunately.
Okay,
That's a little bit separate from what we're talking about tonight.
all right.
Hi, I'm Dave Diamond, 3 Brett's Farm Road. At one of the first zoning board meetings, this came up, so I'm happy it's landing here. Just for, I think we talked about some numbers, but for a visual, when you take 80,000 trucks and put them nose to to the tail of the truck, for a visual, it goes from Boston to Houston. That's a big convoy. And if it goes on for 6 years, I've actually discussed this one time. Said, why wouldn't you just go in there and get it over with? Just get it done, get it in and out. And it doesn't appear that that's economically feasible. So here's the point. The site is going to shift. It's going to be done in phases. The applicant's done a great job over in Rentham with the project. But if you're going through there, you'll see that shifts around. So I just wanted to interject. If there's planning that's needed or some thoughts about this, we'd love to give us some written input. I brought up at the first meeting, say, what's that brown pile doing over there 300 feet from my pool. And, you know, it's a staging area. It is basically an earth-moving staging area, stump grinding area. If that's going to go on with noise and dust and things, we just got to know, you know. So just some factoids and how do we do input going forward.
Karen McCabe, Lawrence Street. One thing that I didn't see on here, and once again, thanks for the dust and noise pollution, is the size, I don't know the right term, the seismic. I mean, they're going to be digging, if you've ever even dug just for your, you know, mailbox in your own. I live across the street, so I can't dig a foot without having 50 rocks being brought out. So it's going to be not just dirt, it's going to be rocks, and it's going to shake the ground, and there's still, even though I ask at every ZBA meeting, is there a blasting plan? They say, they initially said no blasting, no blasting. Now they say possibly blasting. So we need some sort of seismic plan, because my foundation, everything in my house can shake, you know, never mind the trucks driving by it, which hopefully they won't be, but just the shaking of any house that's nearby. It, you know, we need some sort of monitoring for that too, that I didn't see in here.
Rich, are they planning on blasting? Did they mention that?
They said they were
'Cause they wouldn't.
designing the project to not have to blast, but if they do, they're going to have to follow the blasting regulations.
Typically a seismic
Yeah, which is part of
monitoring.
right.
I mean, this is a common concern. You can certainly do like foundation inspections, make sure there isn't cracking as a result. Yeah, baseline inspection, pre and post, just to make sure there's no damage. Those sort of things can be documented along with the seismic meters. I mean, there's certainly ways to similar, you know, that's
Same thing that the developer pays for it.
But even if they don't blast, I mean, they're digging down 40 feet or 60 feet, like 500 yards from our houses. Some houses 50 yards, you know? So, I mean, you know, we just need something about I mean, our quality of living is going to be awful, but it's also then, we don't want crumbling houses on top of poor quality of living.
Frank, can you address that?
Yeah.
Plus,
Typically,
never mind our septic tanks.
no, understood. And I think they talked about this at the last zoning board of appeals meeting, because there was a resident who was going to have a retaining wall. Basically, anything like that, a geotechnical engineer and a structural engineer is going to have to stamp a plan. That will be a requirement of the permit, so that the town knows that the project was designed and stamped by a licensed professional in Massachusetts. So geotechnical engineers, I don't know if you've ever met any, they're the most conservative people in the world. And the only ones that are more conservative than them are structural engineers. And they don't put their stamps on stuff unless they're sure they're not going to have liability in the future. So I think that would be, again, the zoning board, we're also reporting to the zoning board as well. These issues are typically part of the site civil package, but we're civil engineers too, so we can also make sure that those items are included. And I'm sure Tetra Tech in their site civil review will come up with similar geotechnical structural requirements.
So there will be, if there was blasting, there's the regulations that they have to follow through the fire department. If there's, now one of the things that we're talking about here is addressing noise. So theoretically, if we're going to set up, you know, a noise level and a perimeter, some of the construction activity, which, quote, I think you would feel, would also create some noise. So there might be kind of a washout where, you know, we're working right next door with this construction going on. So obviously, you know, the closer you are, the more likely you'll feel it or hear it. It may, I'm not seismic, obviously, but you can feel stuff, but it doesn't mean there's damage to it. I think are you talking more of a nuisance level to it? Not, I mean, there's two levels, right? There's nuisance versus actual damage level.
Well, the nuisance, I would think, would be with the noise level, right?
Yeah.
With the noise meters. But, you know, like we said, the foundations and our septic systems, plus it changes, we have our wells. You know, it changes how our wells, if the ground shakes, you know, they may say it may not impact, but I promise you it does. So.
And that's where that the pre-survey would have to, if in fact they do that, they'll have to, we can, I think maybe for the public's benefit, they can discuss what those requirements are ahead of time as part of the hearing, unless you're already familiar with them. But if not, maybe just what needs to be done.
Yeah, at the zoning board level, I mean, you would want to talk to the civil engineers that are reviewing the package for the town and make sure that the noise and vibration monitoring, which are typically packaged together in a plan, and they always, like Paul said, baseline, then some sort of frequency for inspection during construction, and then a post-construction inspection so that you can document. And then there's action levels where if there are cracks in a foundation, they measure the thickness of them, and if they see that they exceed an action level, that they're getting worse, then it stops and repairs are made.
Yeah, but this board can also recommend it too, because I recommended the dust meters and was pretty much shot down the last meeting. That any average building like this doesn't happen, and I said I think we need to be a little bit above average, and I was then told, like yelled at by one of the board members, that I was out of line.
Well, ma'am, you're not, since it's on our list of things that we're going to in fact be addressing.
Seismic one is always part of a blasting plan. That's almost,
Outside of blasting.
yeah,
Blasting or no blasting, they're digging 60 feet down. You can come dig a hole a foot in my yard,
Yeah.
and it's 80% rock, maybe 20% dirt, and they're going 80 feet down. I don't know what it compiles. It's only across the street from me, so it could be different. It couldn't be different. I have no idea. But, it's, if you dig into rock, those diggers can still dig pretty. They don't need a blasting plan to get through some of that rock, right? They'll only blast when they get those huge, outcroppings of rocks.
I'm not going to speak to, say, the geotech part of it. Technically, when you're in the
Yeah.
bedrock, you're going to feel it more than taking the rocks out. But anyway,
Right.
that's something, again,
So
more
that's what,
addressed
it's
at
just
the
not
zoning
part of
level,
3,
right?
4,
That's-
and
I imagine it
5.
was discussed at the zoning board, as opposed to, the excavation's not a Board of Health issue, is what we're saying.
No.
It is for me.
If it affects your well and your.
But that's a retroactive thing. We don't know that for sure. Right now, we're talking about excavation is not part of the Board of Health's purview. That would be something that's addressed under the zoning board as far as any specifics to that permit. What we're talking about is health issues, what we're talking about right here, and what we just mentioned with the noise, with the Jake brakes. We're not trying to push this or kick the can down the road. We're just saying it's not, we really can't control that, so.
Maybe I misunderstood, but I thought Karen was talking about this as far as a quality of life issue, though, too. I mean, the level of noise that this could create
And
on a
we
daily
are
basis.
discussing that.
So I guess what I'm saying is there a possibility to address some of these concerns she has as far as seismic activity in terms of this addressing you're talking about with
Seismic
noise?
activity, anything with the excavation is going to be in the zoning board as far as the permit specifics. What we're talking about here with the dust and the noise, we're going to cover and
Right.
make our recommendations to.
Right, and I'm saying, is it a possibility to include her concerns part of the noise? If you're going to address
The noise is going to be addressed.
Right, but isn't that part of the seismic activity as
No.
well? Is that, it's not? So that
It's
it's going to be
any
silent when that
noise. Any
seismic?
noise that generates from the site, because the noise monitor is not going to tell the difference between above ground, underground, or whatever. It's a noise.
So you're saying it's going to be addressed? That's what you're saying?
Yes.
Thank you.
Other comments on 3, 4, or 5? I think we have a drift here. I will just say one thing, and this is just to be upfront. The Board of Health in Norfolk traditionally doesn't do dust that often. We're big on things like septic tanks and leaching fields. So normally, these kinds of requirements would have been carried out or tended to by other boards. But in this particular case, we have this new function to be sort of advisory to the ZBA, for example, on health-related issues. So we are a part of the conversation on this one this time. But we're looking for expert opinions in terms of the details, because this is not something we are very historically involved in. But we are very happy to sort of still be the overseer of the whole operation from a public health perspective. So that's our job. So I just want to make it clear, we have our own expertise, but we're looking for others as well to help us do this job. Anything else? All right.
I just have one other quick question. Again, Dave Diamond, 3 Brett's Farm. This may be a hypothetical, but I'm glad you brought that up about kind of the jurisdiction. If Weston Sampson, through the testing process, or Mabbitt comes up with some exceedances in some in chemicals, I'm pretty focused on chromium-6. The project, when that trigger happens, and there are public wells within, say, 150 feet, and the depth may be close proximity to that, whose jurisdiction is that? Does that wind up with the Board of Health being an advisor to it, and the wells? And I mean, I'm just trying to figure out if that's a hypothetical where that lands.
We are responsible for groundwater.
For groundwater? Okay.
But in terms of who swears out a warrant, actually, Frank, if there's a groundwater contamination issue.
Yeah, so in the state, there's a 2-hour notification condition if you exceed a GW1 criteria in a drinking water well, and that automatically puts you into a higher tier classification with the MCP. So you become a tier 1 site, and that's when DP gets direct involvement with all the phase reviews and the documents that get prepared for the site. So if that's the case, the minute the owner of the property has knowledge that there's an exceedance in a drinking water well, they have 2 hours to notify DP, and then that will trigger a new tier classification and whatnot.
Just maybe a point of clarification. I think the question is related to a private well on a private piece of property.
Yes.
So what you're talking about is a public well.
No, it's both.
Both is both private and public.
Absolutely.
Okay.
Yep.
And it would trigger a whole nother set of response actions. You'd have a new probably release tracking number, an immediate response action plan, what's the frequency of sampling, how's that going to be mitigated, if it's a well that's being used, is it bottled water, point of entry filtration. I mean, there's, it spirals from there. That's just the beginning.
And Larry Wilson, Lawrence Street. We just brought up the point that water and septic is your purview. At this point, we also brought up if we hit past some threshold in a private well, it sets up it triggers a number of other events and definitions. So it goes to the point is what are we doing about, are we going to test these wells before this project starts so we have a baseline? And again, the course, who would pay for that?
Well, it's part of that. Typically, that's, you go through your iterative process starting at the source area where you have the contaminants, testing the groundwater, and then going out from there. What's that?
And you also, as part of that process, in the MCP, you look at receptors and who could potentially be affected by the contaminants. It's called the site conceptual model. So you look at who could potentially be affected by the contamination. So if the drinking water wells were a likely endpoint for the contamination to migrate, that would be beholden on the people doing the assessment to evaluate that potential receptor. And it's, it's like workers or inhalation for the dust. These are potential receptors from contamination that need to be evaluated in the risk assessment when they collect their data. It's part of the process.
Our understanding is that this is complex aquifer. Different tiers may be flowing different directions depending on how deep you are. Many of our wells are somewhat deep. You're just taking a guess at this point as to where that water is and how quickly it gets there. I can tell you, if it's a dry summer, I know it pretty soon on our well, and we're pretty deep. I know the structure, the water quality changes because we start getting rust in our laundry that we don't get if we have a normal or a wet summer. So it responds fairly quickly, within a summer, within a drought period, within a month. So back to my point, we're guessing on anything we do. So I would ask that the Board of Health actually set down as a baseline, given everything you said, of going out and testing the wells within a certain area So you have a baseline. You actually know that you have a triggered event.
I know that, the responsibility of testing wells will be on the developer's LSP. And he would have to be the one to do the conceptual site model to say there's contaminants in groundwater and prove the pathway to the wells. It's not very conventional that people just go out and start sampling all the wells when they don't have hits in the groundwater at the site. So.
Okay, is that something you'll put in that boilerplate, that if you have a hit, the wells will need to be sampled?
Yeah, I mean, that will be required of them to define the extent vertically and horizontally in groundwater if there's an exceedance of a site-related contaminant in the groundwater.
Okay.
So that's in the regulation. They have to do that.
But the wells then have to be tested.
I would say if, as they collect the data to evaluate the nature and extent of the contamination, if it's leading towards potentially affecting the wells, that's where they're gonna have that responsibility to evaluate that, and we would comment and review and look at it. So if for instance, a well is put in close, a monitoring well is put in close proximity to a drinking water well and has impacts, that would suggest that the obvious next step there is to evaluate whether the drinking water well has been impacted. So again, it's an iterative approach when they collect the data. If it suggests that there's impacts on the wells, that's where the well testing will start to be discussed. And that's the typical process in a nature and extent evaluation. Again, with consideration of the nature and extent of contamination and potential receptors, that's the standard of care that the MCP directs that the LSP must follow, and we'll be reviewing it to make sure it's done. And I should say that DEP, it's obviously on their radar screen as well. So I would be surprised if they're not taking a look at these submittals as well.
And that's why they have that 2-hour notification condition and an automatic upgrade in the tier classification of the site if there's any impacts above a drinking water standard from the site. So.
But you wouldn't know that since you haven't tested the wells before.
Well, you have to have evidence showing that the fate and transport of the site contaminants are getting to your well. You have to sample the groundwater first at the site to show that there's a pathway.
Okay, I'm not aware of any sampling that's occurring that, besides going towards the river. I don't see any sampling going the other way. Are you aware of any?
So we asked them to review all of the placement of the groundwater wells and the viability of the groundwater wells that they're monitoring on the site. We actually made recommendation to install a couple of new wells where they didn't have coverage. So we're trying to get to that point. We also asked them if the wells don't have good connectivity to the aquifer, that they either redevelop them so that there is connectivity or install new wells.
Good.
And that was common. So that's the first step. And honestly, like in this site, if there was hexavalent chromium hits in the groundwater, we'd be having much more comprehensive comments about groundwater sampling. That's something that the DEP, the LSPs, and the environmental community has to pay very close attention to. We don't have that evidence yet that says there's site-related contaminants that could migrate to your drinking water well. We can't say that at this point.
Okay, thank you.
You're welcome.
Dave Diamond, 3 Bretts Farm Road. Just a real quick question. It might be helpful for us to know how deep our wells are. I mean, a lot of us have bought our house and we're not really sure. Is that public information?
We have record of it.
That would, I think, allay some of the concerns. And just one other comment on the chromium-6 mention. At our second meeting with Mabbitt, an hour and 16 minutes, Steve already said, I don't know an LSP that would test or would characterize a risk for a hit of 79 on chromium-6. And that was upsetting to a lot of people. So I think that's the developer's LSP. It was 0 to 1 foot of testing in one location. So I just wanted to let the Board of Health know that a lot of people are concerned about the ability to find a hit. Are we looking for where the chemical is or where it isn't? So I brought that up before, but I think one of the things we could really hone in is how deep are our wells? How close are they to that hit?
So when they prepare the report, after they do the testing, after we agree that they've characterized the nature and extent, we would ask for hydrogeologic cross-sections showing from one site, north, south, east, west, private drinking water wells and how they connect to where the wells were tested. So you see a fence line diagram with, here would be your private well, here are the wells that are shallow that were sampled, and if any are contaminated, we would say you need to go down deeper or sample the private wells at that point if they're impacted. So they would have to give us that geologic cross-section. That's a typical deliverable as part of a Phase 2 comprehensive site
They
assessment.
can always go back and go deeper or look when you
Oh, yeah.
approach.
Yeah, absolutely. If they have to show that the fate and transport of the contaminant is defined so that they know how it's degrading in the aquifer, how it's traveling in the aquifer, how it's diluting in the aquifer, where's the ultimate endpoint for that contaminant. And it could be degradation, it could be dilution, but they have to show that in the comprehensive site assessment.
Thank you.
I guess the question I have too in this is, has anybody considered testing the water on their own to do some investigation? And if they have they seen anything? Because in one sense, the applicant's LSP is going through this reiterative process, but if somebody was to get their own water tested and they found something, I mean, there's nothing precluding that to happen, to then present that information to the applicant's LSP to say, yeah, I have my private well, I've had it sampled, and this is what's been found, and I'm not consuming my water anymore because it is contaminated.
Well, I think, and somebody can speak to it, the cost of having a well tested for some of the things that we're worried about is, I think, what is it, $1,000? $1,500. And besides that, even if it was $50, there's something about it living in this country, being an American, that says that because some speculator comes in here and wants to tear a whole mountainside apart, why would I have to pay anything on top of the degradation of what's going to occur to my life and my property values? That just doesn't seem right. And this is one of those areas I think we'd like the town to help us with if they're moving ahead with this, and test that water, test those wells. Just give us a baseline.
We're working on a baseline that's basically a radiating baseline, starting with where we're likely to see something, which is the site itself. And then if we see something, all of a sudden, the ripple effect starts to essentially take life. That's what Frank was talking about, too.
Well, I absolutely agree with what he's saying. At the same time, there's a good point over there, which is there's two ways of sampling. One is to hope you don't find something, and one is to go in there and try to find something. We all know that if you don't want to find something, quite often they don't find it. If you do want to find something, you also have a tendency to find it. So there's a certain amount of bias built into it.
Well, the group around this table, I don't think, is leaning toward not finding something.
That would be Paul and I, even involved in this project, could lose our license if we agreed to a sampling plan that was developed to not find contamination. That is not.
I understand, but there's gray. There's gray. And
I think the point I was trying to make about the sampling of your own well was that, if Frank, correct me if I'm wrong, that the way the process works to the MCP is the LSP of record puts forth their scope of work, their testing plan. We comment on it. We don't necessarily have the authority to dictate how they're going to execute this. And so the point was that I agree with you. I wouldn't want to pay for that water sampling. However, at the same time, if I was concerned that my family was at risk, I think I would consider about testing it on my own. I mean, I'm not going to put, I mean, that's just me, my fate in some other developer that would balk at it. That was the point of doing the sampling on your own if you do find something. Because these are, if we're talking about contamination, where you're talking about health risks, I wouldn't want to put that on somebody else. And that was the point.
Well, one of the first meetings we had, that was brought up. This whole subject of testing wells was brought up and the cost of it and things like that. Before you folks were on board, this was brought up. And one of the things I think we had said then is we need to have professionals who would evaluate what's going on and see if that's something that needs to be done. And that's kind of what we're talking about here. Like I said, we've heard everything we've heard. These folks here are working for us. They're working for everyone for this town, and they're being conservative as possible, and they've reviewed everything, and what they're saying, if I'm hearing you right, is, we don't need it yet, you're not there yet. But if something that shows up is there, it'll be required. I mean,
Absolutely, yep.
so they're fair for us. I mean, we hear you. From day one, you've always said your wells is concerned. You don't want to pay for them. We've
That's
understood that from day
the
one.
highest concern, really,
Right.
is drinking water well.
And that will be in the language that you put out as regards to
The
the
comments.
It
steps.
has to happen.
Yes,
Okay.
yeah. Groundwater is the number one transport mechanism from a site to off-site.
Understand.
Okay,
I just want to
so-
make sure it's in the
Yeah,
language.
absolutely.
Yep.
It's in the rules, and if there is
If it's in
something
your
that you-
water, it could be in our water, So we
Well,
all
you
want to know.
I don't know where you live.
Water's water, it flows.
No, well,
We're concerned about that, and that's
Mike.
why we recommended the downgrading property status for the water supply area.
Sandy Knight, Eric Road. So the timing of all this seems to just keep getting delayed and delayed, and so now you're on board for a certain amount of dollars. And you know where potentially there might be some hits greater than 79 on the Chromium 6. Are you allowed to go on site and just do a parallel test now?
No, that would be considered doing response actions under the MCP as an other person, and the town would then potentially open themselves up as a potentially responsible party for the site. So we are collecting split samples at the time of sampling to validate the sampling method, the analytical method, and to make sure that when they are sampling, that there was some concerns about, are they only sampling leaves or detritus? Are they in the soil? So that is something that we recommended to the town to do. The town to go in there and do their own sampling opens up potentially liability for the town as a responsible party. I don't think anyone wants that.
And you had say on
Even if it
location
was
as
the
well,
Mill
right?
River?
Yes.
Right, so you looked
Yep.
at locations.
Yes.
Even if it was the Mill River, which is technically not the property, or?
No, so then now you're starting to get into what's the disposal site boundary versus what isn't. So if there's no testing being done, like this downgrading property status, we are going to the ultimate depository of the Mill River, because it's my professional opinion that Mill River doesn't have a lot of depositional areas because of the velocity of the flow, and that most of the sediment that could wash into that Mill River is going to settle out in a low-energy depositional area. And when we looked at the town-owned land, it could be part of that town-owned land. So
Test
those are going to we have testing that has to be done to show that we're demonstrating a downgrading property status. Okay?
Can I ask you two questions? So if you test something, you become a responsible party and you can't walk away? Is that what you said?
If we go in, yeah, I mean, sampling is considered a response action under the MCP when you're on a disposal site,
So anyone who tests becomes responsible?
potentially.
So then the other question I also had, could you just review that 2-hour thing you were talking about? I didn't really understand that.
So in the MCP, there's notification conditions. There's 3 tiers of timeframes when you have to notify for environmental conditions that are discovered at the site. The highest, the most critical areas are notification conditions are 2-hour notifications. And those are like oil and a sheen on a surface water body, like really serious things. And one of those notification conditions is an exceedance of the drinking water criteria in a well, a drinking water well, either public, private, it doesn't matter. Even an aquifer, even in a potentially productive aquifer or a GW1 area.
So that that 2 hours isn't a deadline, it's when you're supposed to.
It's when the owner of the property who's responsible for the contamination gets knowledge. They have 2 hours to notify the DEP.
And there's some sort of punitive action if they don't
Potentially, yes.
Okay,
They get
that's
a
what I
notice of noncompliance. Yeah.
Okay. I just wanted to make sure it wasn't a deadline. That's what I was confused by.
Oh, it is.
No, I meant in other words that if you didn't report within 2 hours, then it was
is.
nullified.
Yeah. We have clients that get fined by DEP if they knew about a notification condition and didn't report it to DEP in 2 hours. They can get fined.
No, that's not. I was thinking I meant if you didn't report in 2 hours, it
Nothing
goes away.
happens.
That's
Oh,
what
no,
I was
no,
asking. Thank
definitely
you.
not. Yeah.
All right.
People would like that.
We've moved a little bit away from our dust and pollution issues, but if there are no more comments on those first three that we were talking about, we have kind of drifted off here into sort of the traditional issues that we've been dealing with, Buckley and Mann issues, if you will. And there are some of those issues that are important to the board. They have been for months and months and months, including the gaps in testing and the fact that we just don't know. I mean, it's back to the point about, is there groundwater contamination? We don't have a comprehensive view of that site to know that for a fact, yes or no. And that's where we're filling in that blank right now and designing a plan that'll do that. Are there other items up there that need Board of Health recommendation to ZBA? I'm thinking particularly of the issues around the carbonizer trench, the concerns over the orange water. Are those things where there's requests for guidance or?
I think, if I remember, I think we kind of lumped those into all through the PIP process, that's where, right, that's, they're being covered through the
All
work
right.
for us.
All right, that was, yeah.
The only one I would say I am a little concerned about, though, is we have asked about the building and foundations, and we've been told often, and maybe this is because of the perimeter thing, that those aren't going to be touched. And to me, I'm very concerned because I know there were some dry wells and things like that, some pipes, all kinds of things under there. That's one I am genuinely concerned about, because who knows what's under there? It's under concrete. Who knows where it's going to? So,
And we had commented that we wanted better coverage and test pits around all those foundations, as did Friends of Lawrence Street as well.
thank you.
Yep.
I'll keep it, you'll be on before
Eric Diamond, 340 Main Street. Number 6 up there has something to do with, I think it was 6, Zone 2. Are there any local bylaws that may get overlooked with the new zoning map that doesn't show Zone 2s that originate outside of the town of Norfolk?
Need water protection areas?
Yeah. So the new one that we just voted on a week ago only shows the locally sourced Zone 2s.
It doesn't show the zone.
Franklin
that was
zones?
over this area before it took that out.
So Frank, you can correct me if I'm wrong. The Zone 2 that is the Franklin well is regulated by the DEP, which is something that they need to adhere to at the state level. The one that we just did at town meeting last week was another layer at the local level that we have for regulating land use for the town itself. Having said that, even if we had that in, if our map included Franklin Zone 2, they theoretically, again, it's a 40B, they would ask a waiver from a local regulation, and then they'd have to be, then they would fall down to being regulated by the DEP Zone 2. So that's kind of the safety net, is the DEP zone. It doesn't get them away from that Zone 2.
What if it wasn't a 40B, if it was just another development in the area? Are there other Zone 2 local concerns that can be bypassed?
If it wasn't a 40B.
Yeah, town bylaws.
So the Zone 2 still is applicable, even though, I suppose it was the question, I guess, what, if it was a specific use? I mean, the area is zone residential, so that's, you know.
When they're evaluating risk, they have to look at all sensitive receptors. So irregardless of what town it is, they have to look at the Zone 2s and receptors. You know, who's drinking the groundwater? Is it a residentially zoned? Are there kids there? Those all have to be taken into consideration when they do their risk assessment to look at it. And a part of that is bylaw. So one of the triggers for groundwater classification is local bylaws. So that's something that the LSP should certainly be looking at as part of their evaluation and doing their risk characterization. It's what receptors. So if you have a Zone 2 and it's from Franklin and the contamination could be encroaching, that needs to be taken into consideration when they do the risk evaluation.
Yeah, but the question is, we don't show those Zone 2s anymore if they originate from out of town. It's not part of the.
It doesn't matter. Yeah, they get what's called they use like statewide mass DEP GIS mapping when they look at the current or potential drinking water sources, which include the zone 2. So it is like without town boundaries is what they have. It's really distance. So they look at various distances out from where the edge of the contamination is. It goes a little bit to the drinking water well question. Where are the proximity to the potential receptors? They need to identify those and evaluate whether the extent of the contamination could encroach on those receptors. Does that answer it? Did it get you?
They're going to have monitoring wells within the zone 2 to look for contaminants. That's what number 6 is getting at, and that's where we recommended some additional wells, down gradient of the consolidation area, and in between the Mill River and the Carbonizer Trench, we made recommendations for new wells. So the whole site is in a groundwater aquifer. So that's the highest level of the lowest criteria for contamination. So they're being held, and that's when they write their report, we review it, and if they don't do it correctly, we will comment, you didn't do it correctly, and you should have considered this. So.
I guess maybe the question is more specific to Town of Norfolk bylaws, specific to Zone 2, if there are other concerns in that area, just because we don't show that zone anymore.
Our current zoning, your worry is that our zoning is not up to date, or what exactly?
They changed the maps, and the question is why? I think, why change the map and take that zone 2 out of our map showing the areas of zone 2? So then they balked on, when we brought it up, they balked on updating the map because they'd have to go to another iteration and they'd lose 6 months or something.
Well,
Water department did?
No. So just a point of clarification. So the map that was adopted at town, DP Zone 2, in the bylaw before November 27th, brought you out to the Oliver GIS state map that has the DEP Zone 2s, which includes the town of Norfolk and all the surrounding towns. The DEP, as part of the development of the Holbrook Street well, said that that's inadequate for the public at large within your community to be able to know where the Zone 2s are. You need to produce mapping that is readily available in hard copy as well as online. What we did was to make it, what we thought, a little bit easier, is that our Zone 2 aquifer bylaw is regulating in the boundaries of the town of Norfolk. So that didn't change. All we did was put that map, the overlay, the Zone 2s, our Zone 2s, that already existed, to make it more readily available to people to see where those areas are. And we are regulating, we didn't change anything. We regulated the same way we did before town meeting and afterwards. What the question was adding adjacent town Zone 2s onto ours and regulate their Zone 2s as we are in the town of Norfolk, our own wells. That was a different conversation. It couldn't be done at town meeting. That would go beyond the scope of that particular article. The discussion was when the Holbrook Street well Zone 2, which is probably going to be expanded because they're looking to have a larger withdrawal, at least from a permitting standpoint, is going to increase in size, then we can have that discussion. But bear in mind, there are adjacent towns that our Zone 2s go into that they're not required to regulate either. So there's no reciprocating. So it's not a bad idea, but we also need to think about, if we're going to do it, we should have reciprocal agreements with the adjacent towns, because we're providing them theoretically greater protection than they're providing us.
I gotta go.
Come in.
I back everything the consultant said.
Right behind him. All right, I think we have, had a fairly useful conversation here and understand, I believe, what we're asked to do.
Hope so.
In terms of immediate needs from this board to the ZBA, which is, I hope, a fairly brief statement of our concurrence in the need to provide guidance on items 3, 4, and 5,
Correct.
with the details to be forthcoming, because we really, right now, are pretty clueless exactly on what sort of devices you put around the outside of a construction site for online detection schemes, and all that kind of stuff. We don't know.
Tonight is definitely to get the Board of Health to say, yes, 3, 4, and 5 are important to us as issues we want the ZBA to address, and then we'll be forthcoming with the details.
Shall be done. Yes.
Can I ask one other thing, long-term? So the eligibility letter on Abbeville the Preserve requires the applicant to widen the road and provide water on Lawrence Street. Is that something you could also put in? Because I really am concerned about the safety of the road when there's an additional 200-plus houses coming on Lawrence Street. I mean, I'm just asking you to reaffirm what's in the eligibility letter.
Well, certainly the delivery of clean drinking water is a Board of Health issue. The widening of the road is a public safety issue,
Oh, it doesn't fall under health. Okay.
not to my knowledge. We don't do roads,
No.
but we do water. We're really good at that. So,
Accidents are health, right?
what's that?
Accidents are health.
Well, yeah, but not the Board of Health, no. There are other folks taking care of that for us, that's what I'm saying. Yeah. So yes, in terms of the issue around access to potable water, that is a Board of Health issue. Absolutely it is. If for whatever reason in the future, all of a sudden there was a contamination problem in and around 17 Lawrence Street, that would require Board of Health involvement and, guidance. And if it meant everybody gets town water, maybe you don't want town water, but that'd be a very logical solution to that problem, short term. And then cleaning up the mess that created it in the first place. Thank you all for your attention. To be continued. Thank you, Frank. Thank you, Joe.
Good night.
Hey, Richard.
Talk about who will serve.
They're like the thinnest,
We should nominate Jeff.
I agree.
Harold?
That's a fantastic idea.
We got gophers and groundhogs.
This is the
That's what happens when you leave early.
zoning, B1 zoning?
Yes.
Do you have the steering committee?
We had our roots in fruits.
Certainly we can ask them.
It's all the Chelsea.
We
Yeah.
have 2 votes. I don't know.
That's right.
That was a motion, wasn't it? I think that was a motion.
I mean, unless.
Is
one of
Fran
you
about
want-
to move to nominate,
I make a motion that we nominate Jeff Kane to be the representative to the B1 zoning district steering committee as Board of Health representative.
I second that motion. Any discussion? I don't hear any. All those in favor?
Aye.
Aye.
Oh, excellent. Thank you.
Well done, gentlemen.
Very good.
Well, we had a,
Thank you.
since Jeff is not here, we just got voted into a,
Work on another name.
anyway.
Yeah. Well, thank you.
Well, we obviously need to have some kind of
Yeah.
communication here.
Yeah.
We are, we're discussing town business here.
Oh, I'm sorry.
No, you and I are.
Oh, okay. All right.
Could you sit down at the table again?
Sorry about
Thank
that.
you, the camera's
I
getting
thought you were
back.
closing the meeting. I apologize.
No.
No, I was just recommending, and for items 3, 4, and 5, we can pull some detailed specifications to go along with that as suggestions to the zoning board, and then we'd probably have to collaborate with Tetra Tech
That's correct.
to make sure we're not overlapping on recommendations, because I'm thinking they're going to have dust monitoring as well as part of the site civil package. So, but I feel like at the last zoning board of appeals, they were talking about kind of conventional dust monitoring, And I think with the PIP site and the release site, it kind of elevates it to a little bit higher level where we had more experience with that. So,
All right.
Great.
All right. So for right now, just our acknowledgement that these are important issues for us, and we will be providing advice and guidance.
Yes.
Okay. We'll do that immediately?
Yeah, we can draft a letter and then,
Not right now, but
well, not that immediate, but we can draft a
Soon.
letter and
Of course.
then
Yeah.
vote on it, right?
Ye-
You did?
Yes. Do I
Did
need
you
to
vote
make a
on it?
Want
motion?
to
No,
so
they-
move that?
I'm sorry?
Would you like to so move what I just said?
I make a motion that what,
That we will be providing the ZBA with a notice of the Board of Health's engagement in formulating noise pollution and perimeter dust assessment guidance.
to the permitting process with the zoning board. And I make a motion, you made the motion, I second it.
All right, further discussion? Hearing none, all in favor?
Aye.
Aye.
Technically, you probably should be, that's all right.
We'll figure it out.
All right. And we'll put together a letter and then you can come in and sign it and then.
yeah, I would recommend 2 locations to be determined because I'm
Yeah.
sure we're going to have a lot of discussion on
Correct.
perimeter monitoring stations.
We'll draft
We'll
a
draft
letter.
something and,
Then we'll send it over and then get it back and you can come in and
Yep.
sign it.
all right, all right. Thank you.
All right.
Thank you again.
Good night, guys.
All right,
Thank you. Thanks for all your help. Okay.
all right, back to the agenda.
Good night, guys. Talk to you later.
Minutes.
Minutes, we have
Chance
the
to look at the
three,
minutes.
yeah. Do you have any
So I
corrections?
have no comments or corrections on the October 3rd, 2018 minutes of the Board of Health meeting.
there a
Make a
motion to
motion that we approve the minutes.
Second, all in favor?
Aye. Okay. And then
Correspondence?
correspondence, the only issues that I wanted to bring to your attention were the infectious disease reports, or MAVEN reports, as Alyssa mentioned. And so we already talked about that, so there were no other concerns with correspondence. And the only other thing that I'd like to bring up is a follow-up on the concerns that Dr. Hartman brought to our attention and what we do going forward. How do we handle that?
I have a question. So as of December 31st, Tobacco 21 is the law of the land in Massachusetts, which means that you cannot be under 21 and purchase any of these products, including vape materials.
But we already had that in our regulations. The new thing that's going to go into effect in our town is that pharmacies
Where?
cannot. No, that pharmacies, that's the additional piece. We already had everything else. And
But what he was talking about, though, was the issue around only smoke shops could sell. I mean, that's his proposal.
Right. That's right. And I'm in favor of this proposal.
Are you interested in seeing some language?
Because we can get the language from the Municipal Tobacco Control Assistance Program. These are the towns that have already adopted that language in their bylaws. As he mentioned, 140 communities. And we can get that information on how we would, what we would change our bylaws to read. Actually, I think I gave that to you.
You mean our regulation, Board of the Regulations?
We would modify our regulations, and I had given you that information back in August. I can resend it.
Oh, that's okay, if you have it in front of you.
Well, this was from Municipal Tobacco Control Technical Assistance Program, and Donald Wilson is the lawyer. that sent this information to me. And this
Yeah,
would
yeah.
be, is that, yeah, 9.
Mhm.
So maybe we should bring this up at the next meeting?
Well, yeah, now that
No, we have-
we're not the three of us, we should bring it up at the
Sure.
next meeting.
And then decide if we wanted to have, if we wanted to go forward with it, and then we would have to have a hearing, correct?
Correct.
Yeah,
I just
I
have
don't
a question.
Well, okay, I was going to suggest, I don't really have a problem with the concept. The one frustration that I have, though, is that especially the group that we're most concerned about, which is the teenagers. A huge percentage of our teenagers go to King Philip, which means 3 towns worth kids. And right now, Rentham and Plainville are not on that list. He didn't mention them in terms of any prospects in the future of being on that list. And unless we, all 3 of us, get together on this, it's not going to have as much impact as it should have if it's just the Norfolk, contingent.
What would you suggest?
Well, I would suggest reaching out to our friends in Rentham and Plainville to see whether we could, as a 3-town group, take action in unison on this. That would have an impact.
Okay. I think that is one avenue.
All right,
But I think
I'm just
also
suggesting that
yeah,
it's going
no,
to have
I think
any
that's
kind of
great.
effect.
I think that.
Because otherwise, their friends from, the other towns
Sure.
will be sharing their devices.
But, I mean, we can show that we're serious about this by making it happen in our town as well, but certainly reaching out to them and saying this is what our
Yeah.
intentions are.
Yeah, I'm not suggesting it can only be one or the other, but I'm thinking that
Okay.
we have to do both
I think that's a
to
great
have
idea.
an impact. Okay, that's where we're on the same page then.
So, shall we get at least the wording of what the regulation would be, and maybe a letter that we want to draft to the other towns, telling them this is what our intentions are?
Mhm. I think that's exactly what we should do.
Okay. Okay. And I did not get the name of that lady, Sarah.
Sarah McColgan. She is from the Mass Health Officers Association.
Okay, so she might be helpful in, I mean, do you want to draft a letter to the other
She's very
towns?
helpful. I'm sure she would be
Or
very helpful.
I can speak
Well-
with her?
Well, I would say that maybe if she has some ideas of what should be in that letter, we should talk to her first.
I can reach out to her.
You'll do that?
Mm-hmm. I have her email address.
Okay, great.
Okay.
And,
Yeah, it certainly uses the background for the letter, the fact that we're considering this regulation. But we see that it's not going to have as much impact as it needs to have unless we act together and let both other boards of health know our intentions and maybe even suggest a joint meeting.
okay.
Okay.
So we'll have it on the agenda
For next time.
Next month.
Which is probably our last item of business, right?
Oh.
When is next time?
Next time, what is today? Today's December 3rd, 4th. December 4th, okay. So.
Is there a calendar in here?
Here's the December, January.
I don't see January, but
I have, so the next, what night is the best night to have Wade? Do we want to have Wade as well? Tonight's a Tuesday night, and he can't come on Tuesdays, because we never know what we're going to have
right.
on the
I
agenda.
didn't see a need to have Wade come tonight, so.
Oh, but he could have come. So Tuesday night is a good night. Okay. So we have an MRC meeting on January 8th, which is a Tuesday. We could do,
Planning board meeting the 15th.
8:15, okay.
So
So,
New Year's is a Tuesday, the 8th is a Tuesday.
so can we do it on a different night other than a Tuesday? Is Monday night not good? What night is not good for you?
Any night is fine.
Is there a night that's not good for you?
The second Thursdays.
Okay.
Which ran afoul of one of our suggestions at this meeting. What about the third, the third Tuesday in, wait, the 15th is the third Tuesday?
Yep,
and
that's,
bad.
I've got planning board.
Mhm. We could do Monday,
22nd, try to shoot for the 22nd.
do a Tuesday, 22nd? Yeah, that,
I'm sure.
okay.
Okay. Could you send an email around to remind Jeff that we're looking at that? Okay.
Okay, Tuesday, the 22nd, let me just put that down. At 7, okay. Anything else?
Did you get this?
No, I did not, but actually, I printed it out.
Oh.
That was what, I'll get it in.
You want me to put it in my folder? I have a
Yeah, these
nice
are
little
copies.
tobacco folder going.
Yeah, I printed this out at home, so I have this
All right.
information. That's what Dr.
Is that what he
Hartman
gets?
had sent,
Wait.
emailed to us.
Oh, okay.
Yeah, there's another copy that Jeff left.
Okay, so,
All right.
done?
Enough said?
Enough said. So I motion that we close the meeting, the Board of Health meeting at 9:18 on.
All in favor? Aye. We are closed.